You mentioned that you have a 16-month-old son and you're still nursing him once during the night. You recently had some symptoms that made you suspect pregnancy, so you took a test and it was negative. I do recommend waiting another week and retesting, and if that result is negative, then you can most likely safely say that it's not due to pregnancy. You can even wait another week and retest to see what that result is. And any result you're seeing 2 weeks from the point where you're suspicious and having unusual symptoms is pretty reliable, because at that point, you should be able to tell and get a positive result if you are indeed pregnant. Home pregnancy tests are detecting a hormone called human chorionic gonadotropin, or HCG, which is released by a woman's body early in pregnancy, and levels rise exponentially till about 8 to 11 weeks gestation, when they start to kind of peak and decline slightly. So levels just aren't always high enough till about 2 weeks after conception to be detected by the test. That's why you should wait a week, take another test, and then wait another week and take another test if you're still suspicious. As for the symptoms that you're having, you mentioned that all of a sudden you have sore nipples. This could just be due to hormone changes in your body, but it can also be due to improper latch since you're breastfeeding. That's one of the most common causes of sore nipples. Like a baby that's been nursing well could all of a sudden start to latch improperly and cause pain. You may notice that your nipples are sore or cracked. If they're bleeding, none of that is normal. You don't have to endure that. You can try nipple creams, see a lactation specialist so that they can watch your baby nurse and make adjustments if necessary. Now, you did mention that you also have a yeast infection, and yeast infections can happen on many different parts of your body, including the breast. And if you have a yeast infection, it can cause sore nipples, and this can also be passed to your baby. And unless both of you are treated, you just keep reinfecting each other. So it would be worth talking with your doctor about this if this issue persists. If you're speaking of a vaginal yeast infection, these are pretty common and can be treated in most cases with over-the-counter treatments. But if you've tried one of those and it's not working, talk with your doctor, because they'll want to ask you more specific questions, make sure it is indeed a yeast infection. If so, give you a stronger medication, and if not, just treat the cause so that you get feeling better. As for the sharp pain you've been having, this can be due to so many different things. And because I'm a registered nurse, it's not within my scope of practice to diagnose or treat medical conditions. But you're probably realizing that the underlying tone here is that you need to talk with your doctor about all of the things you've been experiencing. After asking you more questions about it and performing an exam, they'll be able to give you a diagnosis and decide if treatment is necessary for it. I hope the best for you, and if you have more questions in the future for me, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.